Good afternoon, everyone. I'm Ruth Hartley, Group Health and Wellbeing Manager at NMCN. NMCN are a main contractor. We operate nationally from 12 regional offices and employ about 1,800 people. My session today focuses on mental health and wellbeing, and I'm going to cover a range of content. The majority will focus on what we have done as a business to assess and support the mental health and wellbeing of our people. But I also want to emphasise why it's essential to strategically focus resources in this area. Before we get into that though, I want to take a moment to focus on a really important person. That's you. And I want to ask you a question. My question is, how are you feeling? How are you feeling? How are you feeling today? And I can extend that. I could say, how have you been feeling over the last week? Or how have you been feeling over the last month? Or how have you been feeling over the last year? And if I asked you to rate your mental health, how would you answer? Would you say, I'm doing okay? Or maybe you'd say, I'm doing really well. I feel like I'm thriving at the moment. Or maybe you'd say, do you know what, Ruth? I'm really struggling at the moment. I feel like I need some support. So I don't know how you are all answering as an audience, but if I did, then I could look at your population and design a programme around your needs. So you can see that these questions are really important, both at an organisational and at an individual level. And I'll show you how we have asked them as a business. But before I get into that, I want to emphasise why mental health should be a key focus area within all organisations. I'm going to do this over the next 2 slides. Morally, it isn't okay to damage people at work, and this includes psychologically. Legally, it isn't okay either. And we know that the construction workers, particularly those in lower paid, less skilled work, are 3.7 times more likely to kill themselves than average. I don't think I need to say much more here. This statistic really does speak for itself, and it gives us an imperative to undertake research to understand why this is and develop interventions to improve this. Finally, research shows that there's a relationship between mental health and work performance. So if we improve the mental health of a population, this in turn improves organisational performance and makes us more sustainable. This conference is focused on addressing the question, how do we transform to a more sustainable existence? And we've been asked for papers that align with the UN sustainability goals. Now I know that most of your papers don't fall under the people goal, but here's the thing. You are a person and you work with people, and without people, ideally mentally well people working effectively, all of our goals are harder to achieve. An MCN sustainability strategy is built on the UN Sustainable Development Goals, and our sub-strategy to have a positive impact on our people is key. As a business, our aspiration is to have safe, healthy, mentally healthy, happy people working for us. But where do we start and what have we done? Well, I'm not going to argue for a one-size-fits-all here, but there are some fundamentals that all organisations should implement. However, these should be adapted to fit the organisational characteristics and context. Additionally, one of the things that COVID has taught us is that we have to adapt our strategy, particularly when challenged by adversity. I'm going to take you along a timeline because we did have to adapt our programme of work to fit changes brought about due to COVID-19. So I'm going to talk you through 3 phases of work: pre-COVID, what we did during COVID, and our direction coming out of COVID. Pre-COVID, and still actually, most of the organisations I encounter focus predominantly on tertiary interventions such as counselling, and whilst obtaining support for people is absolutely essential, It's a bit like treating a wound without understanding how you could have prevented it occurring in the first place. When I joined NMCN about 3 years ago, like most organisations, we were focused on tertiary interventions. Stigma around mental health was still common. Our population didn't understand how to get help, and we didn't have data about factors affecting mental health within our business. To address this, we did a number of things simultaneously. We started campaigns to break the stigma, raise awareness and promote sources of help. But we also needed to do research because we needed to understand the psychological hazards that people are exposed to. So we used recommendations made by the Health and Safety Executive to do this, and I worked with Dr. Ray Randall from Sheffield University to design what became called our Mental Health Risk Assessment Plus. And it's plus because we added additional measures to give us a more nuanced understanding of our people. I'll show you some of those shortly, but first I wanted to take you through the research process. In essence, this research project is a rigorous approach to asking what people are feeling and why. You can see here that the research was conducted in phases and that questionnaires and focus groups were the main methods used. NMCN employed about 1,700 people at the time, so you can also see that we had an excellent response rate and that people were keen to take part in the research. Focus groups were then conducted in each business unit with group composition determined by job role. After this, the research findings were presented to our directors, and under normal circumstances, a steering group would be set up to determine interventions to address the hotspots identified in the research. However, you can see the date here. I'll come back to that shortly, but first I want to take you through the measures that we used. You can see our questionnaire measures detailed here. On the left you can see the HC management standards, or what we call psychological hazards. Whenever I show the psychological hazards to people, they tend to look round the circles and notice the things that they are currently exposed to. So I'd like to take a moment to do that with you now. Are you experiencing high work demands? How much control do you have over how you do your job? Do you have some autonomy? How much support do you have? That could be from your manager and from your peers. What are your relationships at work like? Are they good? Are they poor? Do you experience bullying? Is your role clear, or is it ambiguous? Are you experiencing organisational change? Is that badly managed? So all of these factors in isolation or in combination can cause stress. So if you're one of the people who thinks that you're struggling at the moment, then it's something that's worth taking a look at, because it's possible that these factors can be influenced, and this will have a positive impact on your mental health. So in the grey box on the right hand side of the slide, you can see the additional measures that we used. Now, I'm not going to go through these individually, but I do want to draw your attention to something that we added. Ray Randall has designed some individual item measures that we added into our research. We did this to add some additional information to what we were doing, and we thought it might be an interesting thing to take a look at. However, it did become an important thing further down the line, and I'll come back to that later. So, we'd conducted our full risk assessment. I'd presented the findings to our directors on the 4th of March, and then this happened. 12 days after presenting the findings, we were told to stop all non-essential contact, and 19 days after presenting the findings, on the 23rd of March, lockdown began. Like most organisations, we were trying to figure out what this meant for us. So as a business, we support essential infrastructure, including water, telecommunications and highways. So we had to keep going. The majority of people who worked in our offices were told to work at home, but some people aren't able to work at home due to the nature of their work, and they stayed in the office environment. Additionally, some of our people were furloughed. So essentially we had 4 populations, all in different circumstances. At the same time, practitioners in the mental health arena were trying to determine the most likely impact of living through a pandemic and lockdown and how this was going to influence psychological health. The other thing that we were trying to understand is what we could do to address these negative effects and keep our people as well as possible. I'm going to bounce you through a range of things that we've implemented over this period. But first of all, I want to show you an intervention that has proven to be particularly effective. And essentially, this is going back to the "how are you feeling" question, because we realised very quickly that we didn't have a means of understanding how our people were feeling. So we didn't know if people were struggling. The only way that we would know if they were struggling is if they proactively came forward for support. So what we needed was a means of identifying those people and a process of getting them support. So this is where we're going back to our single item measure that we trialled previously. So what we developed was a daily wellbeing check that we administered through an app. People were asked to rate their mental health on a daily basis, and they were given a range of options so they could identify if they were really struggling through to thriving. People who indicated that they were struggling or really struggling were offered support within 24 hours, and this was administered by our mental health first aiders. Since this system was launched in May 2020, we have supported 91 people who were really struggling and 259 people who were struggling. Amongst that population, a small number of people were experiencing suicidal thoughts, and a small number still had actually got plans in place to take their own life. Using this system, we were able to identify them and offer them support. It's impossible to see a life saved, but we know we have got to people who were at the most extreme ends of psychological distress and put systems in place to help them. I'm going to give you an overview now of some of the additional things we've done to support mental health and wellbeing over the last couple of years. So this isn't a timeline, and it isn't everything we do. And some of the things that we do are continuous, such as awareness raising. But what it does is it gives you a flavour of some of the things that we have undertaken and gives you a sense of undertaking numerous activities to shift the culture of our business. One of the things that I'm particularly pleased with is the culture change I've observed over time. So our leadership are now much more engaged with mental health and wellbeing. Our people are much more likely to ask for support, and poor mental health is less stigmatised. However, we recognise we still have work to do, particularly around job design, and we need to circle back to the hotspots identified in our mental health risk assessment. So now what we need to think about is what's next. I created this slide pre-COVID, but I think it still stands. One of the positive things to come out of this pandemic is an increased awareness around mental health, and people are questioning the effect that work has on their mental health and well-being. We have an opportunity to work with this, and I believe that organisations that support their people and help them thrive are more likely to be sustainable in the long term. I've taken you on a winding journey, but I hope you can see that there is much that organisations can do to support the mental health and well-being of their people. This question is an important one, and I'm going to ask it again. How are you feeling? How are the people in your team feeling? How are the people in your organisation feeling? The answer you receive is going to tell you about the sustainability of you, your team, and your business.